And as the U.S. inches closer to 8 million cases of coronavirus, a key model is now forecasting a spike in deaths this winter by nearly 80%.
So joining us now is our chief health editor, Dr. Partha Nandi. Good Friday afternoon to you, Dr. Nandi. Thank you for joining us. This model predicts that thousands of Americans will die of COVID in the coming months. What can you tell us about this?
Super scary, Glenda. This model is actually from the Institute of Health Metrics and Evaluation. And what they're forecasting, Glenda, is that 171,000 people could die from COVID-19 by February 2021, not so long from now, right? Right now, the U.S. is nearing 218,000 deaths. So if you put the math together, the forecasted death rate is around 389,000 people. That's a lot. Now, the model also suggests a best and worst case scenario. The best case scenario predicts 314,000 deaths, but that's only if everyone does what? Wear a mask. The worst case scenario predicts 477,000 deaths, a lot more. And that's if the mask mandates are rolled back or eased up.
Yeah, some startling numbers there, Doc. So the death rate seems to have plateaued for many weeks. Should we expect the numbers to start rising again?
So yes, nationally, Alan, our 7-day death rate has been hovering close to 700 deaths a day since the end of September. But researchers with the Institute of Health Metrics and Evaluation say they expect deaths to begin increasing in the next week or so. Not good news. And by January, they're saying that they predict deaths to reach over 2,000 a day, which is just scary to me.
Very scary, Dr. Nandi. So as for treatments, a global study found that Remdesivir does not help COVID-19 patients. Remdesivir was one of the treatments given to President Trump. What can you tell us about this?
I'll be honest, Glenn, I was very disappointed to hear this. And I was a bit surprised too. And here's why, because, and we reported this here on 7 as well, in a large study in the US, Remdesivir had shown to actually reduce recovery time by roughly a third in hospitalized patients that was severely ill with COVID-19. Both of you remember me saying that. And many medical experts, including myself, had so much faith in this antiviral. It was given to our president when he became infected. You may remember this with the virus. Now, this global study has included more than 11,000 coronavirus patients in 30 countries and have found just the opposite. And the World Health Organization has said that when it comes to hospitalized patients, the drug Remdesivir has, quote unquote, little or no effect on mortality, and that it was, quote unquote, disappointingly unpromising, which is, this is terrible for me to hear. And it also didn't appear to help sick patients recover any faster. We'll see what the FDA does with their emergency authorization and how they act. But again, it goes back to, we got to prevent this darn thing from getting to us, right? We know what to do. Let's keep doing it. Keep up the fight until we can get good treatments and the vaccine.
Absolutely. Some good information there, Doc, for sharing. Again, some disappointing information about Remdesivir.
Yeah.
I hear you. I didn't like hearing that at all.
No, we keep learning more and just need to keep ourselves safe and others safe. Dr. Nandi, thank you so much.
My pleasure.
And this week on the Dr. Nandi Show, Dr. Nandi is helping stop cancer in its tracks. That's this Sunday at 1 p.m. right here on Channel 7.